good news and there's bad news. The good news is, while the evidence isn't perfect, the evidence is pretty clear that we know a lot about what works. Over the last 40 years, tens of thousands of very good evaluations have been done that have built an impressive evidence base that says if we invest in certain things, we can avoid lots of long-term costs and we'll end up with a much better society. Now the bad news. The bad news is there is no new money to invest in those programs. And the bad news is, although that evidence is fairly clear to all of us who are wonks, that information hasn't really sunk into the policy process. So if we want to move the needle, we have to do something different. We have to bring this information together and we need to bring this information into approaches that are very user-friendly to the policy process, recognizes the political nature of it, and makes it easy to do the right thing. And that's what we're trying to do in Results First, is make it easy to do the right thing, help policymakers identify what the right things are, and then work with them to move the needle in tangible ways. First slide, please. Our approach is fairly straightforward. First is, let's identify what works. Now, we all who are in this briefing know that there are certain programs that have been effectively researched. There's a lot of evidence base out there. The challenge is getting your arms around all that information. And that has been incredibly time-consuming to do. As you all know, the policy process works in real time. If a bill is coming up, if a budget hearing is being held, and someone says, hey, I can find $10 million to put into something, tell me what works, they don't want to hear, give me about a year and a half and I'll read through 5,000 evaluation studies and I can give you a list of what we know about what works. We can't expect policymakers to come to us for this information. We have to make it very user-friendly. So what we've been doing is pulling that information together into single portals. We've been working with research clearinghouses, we've been working with Washington State Institute for Public Policy to build a model that people can go and identify, here's what we know about programs in an entire policy portfolios. What do we know about effective crime prevention programs? What do we know about child protection programs? What do we know about mental health and substance abuse programs? So the policymakers can look to one place for vetted research and say, here's what we know about what works. So the next thing is, let's make that information useful. It's nice to be able to go to policymakers and say, here's a good program, it worked well in Georgia. They'll quickly say, well, that's great to know, I'm in Kansas. What would happen if we did that program here? If you tell me that it reduces recidivism by 10% if you put people through this functional family therapy program, what's it mean here? So we have built an econometric model that answers that question using state-specific information to say, okay, if you do this program here and we're able to cut recidivism by 10% or reduce child maltreatment reabuse by 20%, here's what it means. Here's what it means to your taxpayer system. Here's what it means to socially. If we have programs and research is showing that it reduces crime, it also has implications for educational achievement and later workforces. We're able to put a dollar value on that and give them a dollar-for-dollar comparison of what that really means. And then we're helping states use this information to move the needle and to put this information into the policy process and have them do really what is the right thing. Move money away from programs which are relatively ineffective towards things that work better. And our goal really is to help them achieve dramatic improvements within the current budget resources, because I don't know about you, I didn't see a lot of campaign commercials this time around that said, if elected, I will double your taxes. So we have to come up with ways where it really can help people redistribute the resources in a system to things that simply work better. Now, to give you an idea what this looks like, the first thing we do with governments is ask them, how are we spending our money now? What programs are operating out there? Governments typically don't know that information. Programs get born, they go out to the agencies, they go out to providers, they vanish from sight. They're part of the big appropriation base. So if we really want to be able to repurpose money in the system, we have to break apart that appropriation base. We have to identify what programs are out there and then match those programs against the evidence base. What do we know about the effectiveness of these programs? How many of the programs that are currently being funded in this jurisdiction, is there any rigorous evidence out there that shows that they're effective or not? And we're able to color band that by matching that. Green programs are programs where there's a lot of evidence that this program is likely to be successful. Yellow programs are promising programs. There's some evidence out there that shows that this is a good program, but it's not rigorous enough for us to really say with a high degree of certainty this is probably going to get you where you want to be. There's programs where there are mixed effects, and unfortunately there's programs out there where rigorous research has shown it's not just a bad idea, it makes things worse. There are programs out there that states are putting money into, which unfortunately make things worse. Scared straight programs, research is showing, increases criminal offending by kids who go through it. The domestic violence treatment program, which some states are operating, has been shown to have no impact on domestic violence, but increased criminal offending by the people we put to the program. Probably not what we want to be spending the money doing. So the first thing that we do is really give them this sort of color-banded chart that says, here's how you're spending your money, here's what we know about the effectiveness. Are you happy with the fact that half of your money is being spent on things that there's no evidence of effectiveness on? Or if you want to cut things, you might want to cut things at the bottom edge of the effectiveness ratings and be able to move money towards things where there's more evidence on. But the cool thing that we're able to do with the next slide is by using an econometric model, we're able to compare the cost and benefits of different interventions and say, on a dollar-for-dollar basis, here's what you get if you put money into this program compared to another program. And this model uses the same econometric approach to really give you an apples-to-apples comparison between programs. So we're using the same assumptions, the same methodologies to really say, here's what you get if you put a dollar into this program compared to other programs in the same evidence portfolio. So if you want to change how we're putting money into criminal justice, here's your options, here's what you get if you put money into it. It makes it pretty compelling for policymakers that, hey, you can put money into things that dollar for dollar are much better than what you're doing now. So if you have $5 million more to spend, maybe you want to spend it on something where the evidence shows you can get a 30-to-1 return on investment instead of something that you might get a $1 return on investment, or in some cases, unfortunately, a negative return on investment. We're doing this now in 16 states across the country and 4 counties in California. It takes about a year to implement the criminal justice part of this model and then to build it out into other policy areas. And states are in different phases of this. But of the states we've been working with, all of the states have been able to do this. But our goal really is to build this into the DNA of their budget process. This isn't where we come in and do this for them. It's we're training them how to do this analysis so they can continue doing it in real time during their budget process. Because at the end of the day, it's the budget staff of the state who provide the advice to the policymakers. So our goal is to train and equip the staff in the states to do this work, so it really becomes the way that the states do business. And what we're seeing is that states who are going down this road are moving money. They are eliminating programs that the research shows don't work. When money is coming into the system, they're targeting it towards programs where there's a lot of evidence that they would get good returns on investment. And by being able to give them hard-nosed analysis that says, here's what the dollars you would get if you put dollars into this program, and here's the cash flow that you would be able to get over the next 10 years. And here's the different buckets of funding that would affect, because we're able to break that out. It really makes it fundamentally different in the budget process, because being able to tell people, oh, if you put money into my program, there's benefits in other areas, so good things will happen if you do that, is one thing. To be able to say, if you put $1,000 into this program, in 2 years you should be able to get criminal justice savings of $400, and your child welfare costs should go down by $100, and your special education costs should be able to go down by $55, and your public safety cost of the kids who are showing up in the emergency rooms will go down here, and here's the Medicaid savings you should be able to do. It really makes it much more compelling to policymakers, and it makes it much easier to actually get traction into the policy process. And that is what we're doing with Results First. Now, there's a couple of key issues in the field that I think the field needs to grapple with. There's huge gaps in what I would call the supply chain of evidence. We don't know everything that we should know. And to some extent, that's our fault, because not all of those evaluations, the tens of thousands of evaluations have been done, ever go anyplace. A lot of evaluations never go past the funding source. I would sort of toss out there that if government is paying for an evaluation, that information has to go someplace. It can't just go and rest in an agency. It has to be reported to one of the research clearinghouses. We have to be able to gather that information on what works so it becomes actionable to all of the community of people who are working in this space. We have to do a better job of getting information that makes evaluations useful out there. For example, a lot of evaluations don't have cost information in them. If we want to make the information useful, how much the program cost is really important. The clearinghouses are doing great work. A lot of people don't know they exist. What we're planning on doing with Results First is building a central web portal that you can go to one spot and search across all the research clearinghouses and say, here's what we know about this policy area. That would make this information much more useful and much more accessible to policymakers at all levels of government. We need to do a better job as a community of standardizing how we're doing things like reporting return on investment. Because right now, every program advocate out there is saying, if you give me $1, I will give you back $5, $500, $5 million, $5 trillion. And what it means is that after a while, policymakers will start tuning that out because it's not credible. We have to come up with standards of how we report that information, and we have to be willing to be transparent about that, or that's going to be a meaningless data thing for us. And we have to keep our expectations reasonable. Evidence will change the process. It will change it slowly. It will change it on an incremental basis. The policymaking process is incremental. But by moving 5% of the money every year in 10 years, that's a lot of money. And that has a huge impact on what will happen in the lives of people. So I would say we know a lot, we can do better, we need to develop tools, we need to work together, and if we do that, then I think we can get to where we want to be, which is a much more responsible system. There's one thing that we've recently published, which is a framework for evidence-based policymaking. There's copies over here, and what this does is it lays out all the steps that we think the government should be taking to really embrace an evidence-based approach. And it's not just identifying what the good programs are, it's also things like paying much more attention to how programs are being implemented and steps that governments can take to pay a lot more attention to fidelity. A good program that's badly implemented is a waste of money. We have to develop a discipline of government to do that. We have to develop stronger outcome reporting systems. And if we're able to go to the policymakers and able to go to the citizens saying, on a dollar-for-dollar basis, here's what we give, we put money into this, then I think that changed the system. I think it transforms the types of services we can give to our society, and I think it can transform where our country is going.